This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
So Claire asked me not to do anything political, so instead I'm going to talk about cocaine chest pain. So I was talking, I can't remember who was asking me this the other day, but there's a gentleman who came in and had cocaine chest pain. His blood pressure was high and his heart rate was high, and they said, well, I'm definitely not going to get him beta blockers. So what was the story behind that? Does anyone know why people were told before, don't give beta blockers when you have cocaine chest pain?
Unopposed alpha.
Yeah. So here's the thing. Cocaine, remember there's like receptors, alpha receptors, beta receptors, and cocaine makes them all kind of go up. If you do a blocker just for beta receptors, then in theory you'd have unopposed alpha expression, I guess. So that would cause vasoconstriction. The thought was you'd close off the coronaries and instantly kill the patient. And in fact, there's like case reports of people who gave medicine after someone had like cocaine overdose and they died. So for many years, it was this teaching like never ever give beta blockers. But as it turns out, like so many things in medicine, like don't give Demerol to Russian dogs with, and there's my Russia reference. Don't give Demerol to Russian dogs with gallstones because it causes constriction of the sphincter of Oddi. No, don't give morphine, give Demerol instead. So anyway, that's totally false. This is also a myth. So here's the real data. So this has been forever, like 2008. That's like when Meditech came out. This is a study where they had 363 consecutive admissions to ICU, like a chest pain unit, patients with chest pain, and they happened to do drug screens on them. And of them, they had patients who had cocaine in their system and others who didn't have cocaine in their system. So they didn't even have to ask them because that's not very sensitive. And the people, and naturally when they had chest pain, a certain segment of those people got beta blockers. So of the 60 patients who got beta blockers, the incidence of myocardial infarction after administration was significantly lower, 6.1 versus 26%. So this myth of don't give beta blockers was actually hurting. So this falls into the false category propagated by a case report back in the Stone Ages. The logic was probably right, but the reality is it's not dangerous to give beta blockers to cocaine chest pain.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.